Hello and welcome to EULAR TV, coming to you live from London today. My name is Pratasha Saha, Clinical Research Fellow at the University of East Anglia, UK. It's my pleasure today to be joined by Dr. Karen Schreiber, Associate Professor and Academic Rheumatologist at the Danish Hospital for Rheumatic Diseases. Thank you so much for joining us today, Dr. Schreiber.
Thank you so much for having me.
You've just done a talk in a EULAR session entitled From Diagnosis to Family Building, Navigating Fertility in RMDs. Fertility and family planning can be major concerns for patients with RMDs. When do you think these conversations should ideally begin, and how can clinicians best incorporate it into routine care?
That's a really good question. It's a very important question. So when should clinicians take up these conversations? As early as possible is the true answer. It may be that a patient, at the point when the conversations first start, doesn't have an active desire to have a pregnancy, or for a man to start to have a baby. But I think it's important for them to hear that it is an option, even if it may be in the future. So the more you kind of inform them about it from early on, the better.
Mm-hmm. Absolutely. And we know pregnancy and patients going through pregnancy can often receive mixed messages about things such as fertility and disease activity and medications during pregnancy. What are common misconceptions you've encountered both from patients and clinicians?
So from patients, there are a lot of worries, and that is not dependent on whether you sit in the UK or in Italy or anywhere else in the world or in Denmark, because the concerns are really regardless of borders. So patient concerns are often, will my child have a disease? Can I be pregnant at all? Can I take my medication? So there are plenty of concerns to be addressed. And to your second question, where do healthcare professionals get information? I think it's very important to state that information needs to be provided to the patient from as early as possible. You can refer to guidelines, you can refer to EULAR guidelines about medication safety, about the British guidelines about medication safety. But really the clinician's task is to communicate that it is okay to become pregnant as long as the disease is quiescent, the management during pregnancy is planned, and that the follow-up is planned as well.
Absolutely. And lastly, thinking about some clinicians who may feel less comfortable in giving advice surrounding medications in pregnancy and breastfeeding, what practical advice do you have for those clinicians, especially as new evidence develops?
I think there are helping tools out there. There are the guidelines that I referred to earlier. So these are really, really good tools in terms of printing them off, putting them in your drawer, having them in front of you with your patient, looking at them together, because they're evidence-based recommendations about safety during pregnancy, periconception, but also during breastfeeding or for men who wish to conceive a child. What is important, I think, and what I usually tell my patients is that please do not get advice from anywhere on the internet that is not a reliable source. So it's important that the patient feels the trust to ask the clinicians about their perspective. And of course, the clinicians also need help, because sometimes as a clinician you can feel very lonely if you're practicing in a district general hospital where you don't have access to expert knowledge. We do have the possibility of, we actually have developed a EULAR study group. This is under the umbrella of the EULAR, and it's chaired by myself and by Laura Andreoli. And we have an open door policy. So if you as a healthcare professional are interested in knowing more about the topic, getting a network, you don't need to be a researcher, you can just be interested in the topic, you can join us. So we have frequent webinars with information about difficult cases to handle. So there's actually lots out there. I think we can do much more, but there is help out there.
That's absolutely fantastic to hear, and thank you so much for sharing your insights with us today. Thank you to everyone watching EULAR TV. We hope you have a fantastic rest of your Congress.